Hi, I'm Danny Ecker with your Chicago Business Today Midday Report. Reaction today to the details of Governor Quinn's $2 billion proposed slash to Medicaid funding. All affected parties are considering the cuts that the governor hopes will save a system he's deemed on the brink of collapse, with many concerned about the well-being of safety net hospitals. Our healthcare reporter Kristen Shore spoke with some Medicaid experts about this. This was going to sting some people no matter what. What's the general reaction at this point?
You know, some people are actually praising the governor for coming up with a bold plan that he called for 2 months ago, and he didn't shy away from the controversy. At the same time, there's a lot of key questions that are left unanswered, such as who this is, what this is going to mean for providers, what this is going to mean for access for patients to care. Just because they might no longer be covered by Medicaid, they're still going to go to the hospital.
Right, and some of the major bullet points of the plan he laid out: $675 million in cuts to reimbursement rates, $120 million dropping recipients ineligible for Medicaid. As it stands, who's going to feel these cuts the most?
Well, I think it's going to be a mix. I think it's going to be, as I said, patients who no longer are eligible for Medicaid still have to access care somewhere, and providers who are potentially facing a huge rate cut will still have to cover patients either who are on Medicaid or who are no longer on Medicaid. So everyone's going to feel the pain.
We talked about this in February when the governor sort of pitched this initially. We talked about safety net hospitals maybe being in danger, the potential creation of some healthcare deserts. Does that threat still exist big time here?
I think the threat still exists. It's not clear how the safety net hospitals are going to be impacted yet. The potential $675 million cut to providers that was laid out yesterday is about 8% of the reimbursement rates for hospitals. Julie Hamos, the director of the Department of Healthcare and Family Services, which oversees Medicaid, has said that they want to protect safety net hospitals, but it's not clear what that means yet.
Okay, well, the next step here is obviously the General Assembly taking a look. And is there anything that could be sticking points that you hear that especially might stick out for them?
I think anytime you try and cut services for the poor, that's going to be sticky. You're going to have advocates for patients, providers, both sides all coming to the table. Also, I think increasing a tax on cigarette pack, $1 per pack on cigarettes, that's going to be controversial as well, just anytime you try and raise revenue from a tax.
Absolutely. Okay, well, July 1st is when it'll be enacted, and if the General Assembly gives it the thumbs up, so we'll be watching. Thanks, Kristen.
You're welcome.